How do you master first aid microbiology tables for USMLE Step 1? Imagine trying to solve a puzzle with hundreds of tiny pieces. That's what mastering the microbiology tables in first aid for the USMLE Step 1 feels like. These tables are packed with facts about bacteria, viruses, fungi, and parasites. They organize information by categories like gram stain results, shape, virulence factors, and treatments. The key is to understand how these categories connect and help you differentiate organisms quickly. Start by getting familiar with the structure of the tables. Notice how organisms are grouped, like gram-positive cocci or acid-fast bacteria. Look at the columns. What are the typical presentations, lab findings, and first-line treatments? Recognizing these patterns helps you recall facts faster during the exam. Don't just read through them passively. Make flashcards for each organism or group. Focus on high-yield details like which bacteria are encapsulated or which viruses are transmitted via respiratory droplets. Quiz yourself regularly to reinforce your memory. Using mnemonics can make tricky details stick. For example, remember that Streptococcus pneumoniae is encapsulated and causes pneumonia, meningitis, and otitis media. Visual aids like charts or color-coded notes can also help you see connections between organisms. When you practice USMLE-style questions, try to relate the question to the tables. If you get a question wrong, go back to the relevant part of the table and review what you missed. This active approach makes your studying more effective. Clinical context is everything on Step 1. Questions often present a patient with specific symptoms or exposures. Think about how each organism presents in real life. For example, if a patient has a sore throat with pus on the tonsils, you might think of Streptococcus pyogenes. If a patient has a chronic cough and weight loss, think of Mycobacterium tuberculosis. Linking table facts to clinical scenarios helps you remember and apply your knowledge. Review these tables regularly. Microbiology is a large subject, and details can fade quickly. Use spaced repetition tools or schedule weekly reviews to keep the information fresh. Focus on organisms that come up repeatedly in questions. These are your high-yield targets. Finally, connect microbiology with other subjects like pathology and pharmacology. Knowing that a certain bacteria causes pneumonia is helpful, but understanding how the immune response works or which antibiotics are effective makes your knowledge stronger. For example, knowing that Mycobacterium tuberculosis has a waxy cell explains why it is acid-fast and why certain drugs like isoniazid are used. In short, mastering the microbiology tables in first aid for the USMLE Step 1 is about understanding their structure, actively engaging with the content, applying it to practice questions, and linking facts to clinical scenarios. Keep reviewing, use mnemonics, and connect your knowledge across subjects. This approach makes the information stick and prepares you well for exam day.